Hi everybody, what a great opportunity to be here today, and just to let you know, Newcastle does exist and it's a great place and very nice, so please visit sometime. Not that I'm very there often because I'm generally in Leeds or London. But my role at NHS England as Head of Digital Primary Care, I'm responsible for the local developing strategies for creating and developing digital primary care services to improve access to general practice, as well as reduce bureaucracy for GPs to make better use of resources. I've also got an exciting role of developing the children's digital strategy, which that's about moving us towards paper-free at the point of care, making sure that we've got transparent and accessible information across health and social care for professionals, carers, parents and young people. That's really exciting for me, because joining the NHS 24 years ago in children's services, launching the Red Book, which is the paper copy about sharing information, which still exists today, and we're still facing some of the barriers around how we share information. So I really feel excited that now I'm leading this agenda. So today I want to share with you some of our key priorities and what's been happening in primary care using technology. So I just want to fast forward in 5 years into the future, just to give you a glimpse of what our NHS would look like for patients.
Thank you. Bye.
Obviously 5 years into the future, but some of that's happening right now. No, we don't have to wait for 5 years. We're testing some of that in terms of primary care at the moment. So to realise this vision, digital has become a real key priority. We also need to think about digital as being a universal service. So we are doing small test initiatives, but we need to make that available in terms of in our entire services. We know we're faced with a number of challenges, and digital supports these challenges. It's not the answer to everything. As you've already heard, looking at the business process and understanding the service is really important. But how can digital really support our challenges? We've got an ageing population, we've got increasing patients with complex needs. You'll understand some of these challenges and probably resonate with them. We've got variation in outcomes or service delivery, and we have greater expectations now from patients and citizens around digital, bring that up to the same industry standards of other services. Child health, known that for its fragmented and disparate records. Now we have a complex commissioning environment. Local authorities from October 2015 are now commissioning children's services, as well as NHS England are commissioning the information service. So transparency and access to that information is absolutely key, both for professionals, commissioners and our citizens. So what's really exciting is that technology is not really sitting on the edges of services anymore. It's absolutely integral to that service delivery. It shouldn't be seen as something separate. It's an underpinning infrastructure for our services. This is recognised at the highest level. The 5-year forward view recognises the need for change. Whilst Personalised Healthcare 2020, and I'm not sure if you've seen these documents by the National Information Board Framework for Action, states that it's essential for technology and data to improve quality and efficiency in patient outcomes. Then most recently, Primary Care Foundation and NHS Alliance has published Making Time in General Practice. This recognises technology can create efficiencies and new ways of working. But to realise this vision for our patients, we've got to get the digital basics right. So what we are working on is making sure that we have real-time access to information at the point of care when patients come to our care providers. We need to ensure that we reduce harm by ensuring there's digital information sharing between our professionals. And everybody should have access to digital tools and endorsed apps to help them or facilitate their self-care. So what do we know so far? This is fact. 75% of our patients go online to seek health information. We also know 38% of patients use NHS Choices as a virtual data store, which will affect their decision if they go and access a service or go and see their doctor or not. 50% of patients are using the internet for self-diagnosis. Research has shown that evidence. So we do have a number of digital services already available in primary care. Online booking, ordering online repeat prescriptions, and online access to records. Nearly most of our general practices are offering these services, but as you can see, online appointment booking, 12% of patients are utilising this service, whilst 4% are utilising online repeat prescription. So we need to do further work to ensure that support general practice in making these services available or letting their patients know that available. Online access to records, 97% of patients are accessing or have availability of their summary care record. 5% of general practices are offering detailed care record. So we need to support our general practices of making sure that we support them, enabling them to make this available for their patients. We also know that digital transformation in general practice so far has made significant positive results. Making Time in General Practice published that 6% of appointments could have been seen by another professional in the practice without needing to go to the GP. 4% of patients could have self-cared or diagnosed without any clinical need. And some significant savings around detailed care records. A practice around 10,000 patients, 30% of those patients access their record twice a year, would save approximately over 8,000 telephone calls, over 4,500 appointments. Taking into account all the back office efficiencies would equate to about £29 per patient. And that's evidence what we found. So what do we need to do? So how are we going to make digital technology in primary care available universally? So in terms of our digital primary care strategy, We have to think about technology as being embedded as part of that service delivery. We have to think about that entire operating model. It's not, we've already heard, it's not just about the technology. It's about the commissioning, how we use it, how we promote it. It's absolutely fundamental in terms of how we deliver services. So from the Prime Minister's GP Access Fund and other transformation initiatives like the Vanguards and the Pioneers, we're learning from them to understand what are the building blocks we need to make sure digital is embedded as part of our service delivery. So far we found technical infrastructure. We need standards, information standards, and open interfaces so we've got an interoperable environment. We also need to think about how we contract, commission, incentivise that financial model, which you already heard, around how services are given the funding and supported to move towards a digital environment. We also have to think about primary care. It's not just about general practice, it's about that wider primary care. What are we doing about pharmacists, optometry and dentists, which we know there's little investment in terms of some of the technology in these services. So the work that we've been doing in the last year is providing assurance or providing the facility for our commissioners around data sources and analytics to ensure they can understand their digital maturity across primary care and where they need to put their investment in place to help them with their digital local roadmap. This strategy for digital primary care as well as children is going to be published around summertime, so please look out for that. So how are we going to realise the vision and what do we really need for our primary care? So in the Prime Minister's GP Access Fund, we've been testing some 7 digital capabilities, and these are them from access to records, Wi-Fi in practices, so we given empowering patients to take ownership of their own appointments or care, consultation access in electronic environment, I've already mentioned appointment booking, repeat prescriptions, as well as pre-referral diagnosis. So creating that channel shift for the first interaction with general practice being digital. And also we've been testing some telehealth and telecare and apps, etc., to really see what the patient experience has been. So somewhat's proven popular is things like pre-referral diagnosis. This is an online GP triage system which has care management tools, video guides for self-management. 45% of patients said they were happy to actually interact in services in a digital way, seek help online, complete a condition-based questionnaire and wait for the surgery to give them that signpost and the appropriate service. Consultation access. So everybody talks about electronic access and using video, Skype types of technologies. But what we found in the GP Access Fund is this has been primarily telephone. Birmingham in wave 1 was quite a success and increased capacity for 1.9 patients. We've already seen some of the evidence that 65% of patients are being remotely managed electronically. But video consultation's been really low uptake and patients really haven't quite like it. It's not something what they feel that they like at this moment in time in terms of that direct care. But it's been really effective in multidisciplinary scenarios, how we're supporting our care professionals in care homes. And one good scheme is that Wakefield, 6 general practices come together to put care navigators in their service and trialled real-time web chat to patients. That really improved patient satisfaction, signposted the appropriate services and made better use in general practice. We've already seen from wave 1, 400,000 additional appointments being created, that additional capacity in general practice. But obviously, what do we need to do next? So that's great news. We've got evidence-based that digital services are making a positive impact to our healthcare. So our job is to create that greater scale. We have to link up the entire digital journey. So we've done small testing initiatives, but how do we work? How do we create that digital journey right across an integrated environment? We need to also look at our interoperability. making sure we've got open interfaces. Our technology is open, so we can create that interoperable environment. So we're not subject to what the technology market is. Actually, we've got a much more vibrant supplier market and make better decisions. We also have to think about cybersecurity, patient identity verification and consent to share. And these have all been challenges, what we found in some of our initiatives. We need to build public trust. And actually, if they want to opt out, they have the right to do so. Where we're trying to get to is paper-free at the point of care. We want to make that information transparent. We want to work in integrated ways. We want to create that efficiency. Baroness Martha Lane Fox recently recommended the Secretary of State and the National Information Board. Not only do we have to think about this environment, but we have to think about building the digital skills in our professionals and patients. Because it's fine moving towards digital services, but we need to give confidence to people in terms of how they use it. Being able to use Eggbot on YouTube would be really good. So we need to really build those digital skills and embed that as part of commissioning our services.